Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Calcium is well known as being beneficial to bone. It's a key nutrient for bone health. But calcium is not just about bone. Calcium affects many parts of the body. Lacking calcium leads to fatigue, muscle spasms. It can affect your mood, your nails, even your skin. So we're going to discuss here what happens to your body when you lack calcium, or the name of this episode, Surprising Benefits of Consuming Sufficient Calcium. Hi, my name is Jerry Hickey. I'm a nutritional pharmacist. I'm also the Chief Scientific Officer over here at Invite Health. I want to thank you for tuning into today's podcast. You can find all of our episodes, there's hundreds of them, for free wherever you listen to podcasts, or visit invitehealth.com/podcast. Please subscribe and please leave us a review. You can also follow us on Instagram, Twitter, and Facebook at Invite Health. The info on this episode is linked at the episode description, so let's get going. So, let's talk about what happens if you lack calcium. Muscle spasms. When you don't consume enough calcium, whether it's from food or supplements, it's going to cause muscle spasms. Calcium works at the core level, at the cellular level within the muscle to allow your muscle to contract. For your muscle to contract properly when you're performing physically, you need enough calcium. We need adequate calcium to efficiently move and exercise to our potential. I tell people all the time, after you do intense exercise, one of the reasons why you develop muscle spasms and muscle fatigue is you've pumped the calcium and the vitamin D out of your muscles. So take some calcium and vitamin D after extreme exercise. It'll help replenish this vitamin and this electrolyte in your muscle after intense physical activity, and it'll help prevent muscle spasms. I mean, there's a lot of things that muscle relies on with calcium activity. So if you lack calcium, not only are you going to get muscle spasms, but you could get muscle cramps, muscle aches, and this could be accompanied by joint pain, by the way. You can even get joint pain if you lack calcium. You could get pain in your thigh muscles and your arms when you're using your arms to garden or do something physical, or when you're walking. You could even get like numbness and tingling, paresthesia, pins and needles, that prickly feeling in your hands and your feet, your arms and your legs, even around your mouth if you're low on calcium. So they'll go away after you rest for a while, but they're not going to go away while you're performing physical activity. So a sign that you're low in calcium can be these prickly feelings, these pins and needle sensations. Now, there could be more extreme effects. If you're really low in calcium, you can have convulsions. You could develop arrhythmias because calcium balances out with sodium, chloride, magnesium, and potassium for proper rhythm in the heart. You can actually develop arrhythmias. It could be very dangerous really lacking calcium because your heart's a muscle, and it's a muscle that never quits. Your heart's beating basically once every 3/4 of a second, about 80 times a minute, over 100,000 times a day. So calcium is critical for contraction of muscles. So think about how that affects your heart if you're lacking calcium. It'll affect your heart rate. It'll affect your heartbeat. Now, if you lack calcium, you're going to be fatigued. There's a number of minerals. If you lack them, you're going to be fatigued. Calcium, magnesium, potassium, sodium, chloride. You lack any one of those, you're going to be fatigued. Low levels of calcium can cause very extreme fatigue. So you get this overall feeling of sluggishness, lassitude. But oddly, lacking calcium can also lead to insomnia. And we don't know if that's some kind of interaction between melatonin and magnesium and calcium. We're not sure. Because you need the mineral magnesium to release melatonin at night to sleep, and you need the mineral magnesium for energy in the daytime. And there's this sort of yin and yang relationship between calcium and magnesium. And typically, if you lack calcium, you can also lack magnesium. So fatigue frequently is associated with a calcium deficiency. Now this can, you could feel lightheadedness, dizziness, even brain fog, just hard to focus and concentrate. You could become confused and forgetful. You often see this when it's related to calcium with poor muscle function, if you're not getting enough calcium. Like I said, calcium deficiency can be a result of magnesium deficiency, and both of them contribute to fatigue. So calcium is sort of the partner to magnesium. It's sort of the yin and the yang. So because calcium helps your cells contract, like your muscle cells, where magnesium helps them relax, helps them go back to their normal structure. So the key here is the balance of magnesium and calcium. So most people are not doing a great job with that, by the way. Many Americans are lacking magnesium. So frequently, even with a calcium-rich diet, you may need some calcium supplementation, but you certainly probably need some magnesium supplementation. And that's because it's especially true as you grow older. Now, if you get sufficient calcium, it can help regulate your blood pressure. It can help lower elevated blood pressure. They've shown in studies that getting sufficient calcium from the diet helps lower elevated blood pressure by several points. You have to talk about bone health with calcium. When you get enough calcium, it helps keep your bones strong. I mean, there's powerful correlations between that. It's not the only thing you need for bone health. It's not the only thing. For instance, you need enough sleep for bone health. You need strontium, you need vitamin D, you need vitamin K, you need phosphorus, you need magnesium. You need a lot of things for bone health. You need sufficient collagen production. But calcium is the key mineral that makes your bone stronger. So if you lack calcium, over time you're losing the minerals inside your bone. And if it becomes too hollowed out, it's called osteopenia. It's the start of developing fragile bones that can break easier. And osteopenia, even though it's not the most severe stage of bone loss, you could still have an increased risk of a fragility fracture, easily breaking a bone. But osteoporosis is the worst case scenario. So, I mean, there's very powerful correlations between lacking calcium and developing bone loss. So the bones become brittle and weak over time. I mean, this increases the risk of several fractures, a wrist fracture, an ankle fracture, a broken rib, but also, seriously, spinal fractures and hip fractures, which is scary and dangerous, expensive to treat, painful. It's a long progression to health. So, and by the way, you should listen to some of our podcasts on how important things such as sleep are and green leafy vegetables for bone health. We have some podcast episodes on those. So lacking calcium, it's not just bones, it's also your teeth. Lacking calcium leads to weak teeth. Lacking vitamin D also, by the way. If you lack vitamin D, you could develop dental problems. When your body lacks calcium, it pulls it from sources where it's still available, such as your teeth. So this can lead to brittle teeth, irritated gums, weak roots in your teeth, tooth decay. But you can also develop skin and nail issues. Believe it or not, if you lack calcium, you can develop dry skin, even eczema. That's a kind of skin inflammation where your skin gets like dry and patchy and itchy. And there's some evidence that lacking calcium contributes to psoriasis, which is an autoimmune disease of the skin. But lacking calcium also contributes to like brittle nails, where they break, where they become dry, and they develop striations on them. Coarse hair, your hair needs calcium. In fact, you could develop hair loss, which we call technically alopecia. When you lack calcium, the hair tends to fall out in groups like little patches. So you actually need calcium for hair growth, at age healthy hair growth, especially when you combine calcium with vitamin D, with protein, and the best protein for the hair would be collagen and the mineral silica. Why is vitamin D important? You need vitamin D to absorb calcium from your digestive tract. Whether it's from a supplement or food, you don't absorb it if you lack vitamin D. And vitamin D keeps it available. And then the calcium gets into the hair. So if you lack calcium, you can suffer with hair loss and thinning hair. And kind of scruffy looking hair. Now, there's some evidence that calcium is important for your mood, that sufficient calcium intake is correlated with a better mood and possibly even helping with depression a little bit. Because calcium has a number of effects on your mood and your memory. So calcium, especially when it's in conjunction with magnesium, has a soothing effect on your brain. It calms down the brain, and it calms down your nervous system. So when you take the two minerals together, it's or you're getting sufficient of both every day, whether it's from food or food with the addition of supplements, it's good for calming down nervousness. It calms the brain down. In depression, there's some ongoing research that it helps antidepressants work better. There's even some research now that poor utilization of calcium is part of what disrupts the brain of Alzheimer's patients. Now, there's a number of studies showing that if you lack calcium, you can have severe premenstrual syndrome, leading to fluid retention. And if you give calcium supplements, it helps women with PMS with their fluid retention. And I'm going to tell you something else that's really not known well about calcium, but there's research showing this. Lean body mass. There's studies that show that people who get sufficient calcium tend to be leaner. They have less fat. It's not like you take calcium and it causes weight loss. It's different. Your brain has to sense how much calcium you have in your food. What's your calcium intake? So your brain registers calcium through a bunch of different activities, through the parathyroid hormone, parathyroid gland, and your thyroid gland. So there's all these fail-safe mechanisms for making sure you have sufficient calcium in the body. That's how important calcium is to your well-being. If you're eating and if you're eating and the brain doesn't sense that you've taken in enough calcium, it keeps you hungry until you've consumed enough. So they find that people who get adequate calcium, they're not starving all the time and hungry all the time, and they tend to gain less fat with age. There's also evidence that calcium helps lower the risk of different cancers. It's very easy to obtain research on calcium and cancer risk from the National Institutes of Health or the American Cancer Society's website. So there's evidence that from the National Cancer Institute website, from a whole bunch of studies, that calcium can lower the risk of definitely colon cancer. I'm not saying it's 100%. There's evidence from these studies that calcium really seems to have an impact on lowering the risk of colon and rectal cancers. So the American Cancer Society had a cancer prevention study 2 nutrition cohort. I mean, they give these studies these big names. They looked at the diet and the lifestyle and the medical history of over 120,000 women and men. Men with the highest intake of calcium, now this could be from food and supplements, they had a reduced risk of colorectal cancer compared to men who had the lowest intake of calcium. And the effect plateaued at about 1,200 milligrams a day. In other words, getting up to 1,200 milligrams a day lowers the risk of developing colon cancer, according to a lot of data, but getting more than just 1,200 might not have any additional benefit. That's what plateauing off means. So when they analyzed calcium from the diet, this is what threw them. When they analyzed calcium from the diet by itself, it didn't prevent colon cancer or rectal cancer. It was using supplements. Using a supplement reduced the risk of colon and rectal cancer. Now that could be because it's really hard to get sufficient calcium from the diet. So that's why maybe taking a supplement of calcium paid off. There was a 31% reduction in the risk for people who took calcium supplements of 500 milligrams a day or more. Now, in the Nurses' Health Study, but also the Health Professionals Follow-Up Study, which is a large group of men, so it was more than 135,000 women and men, people who had a calcium intake of more than 700 milligrams a day had a 35% reduced risk of cancer of the distal colon, compared to people who took in 500 milligrams or less per day. In fact, when they reanalyzed it, it reduced the risk up to 45%. It was practically cutting the risk of colon cancer in half. In a study of more than 61,000 Swedish women, the women who had the highest intake of calcium, could be from supplements and food again, 28% lower risk of colorectal cancer. And a study, the Iowa Women's Study, postmenopausal women's study, more than 34,000 women. A high intake of calcium, like 1,280 milligrams per day or more, compared with 800 milligrams a day or less. And this was diet combined with supplements. A 41% reduced risk of rectal cancer. That's amazing. That's really a big reduced risk. And there's other studies showing this. The National Institute of Health, the American Association of Retired Persons, they had the diet and health study. Now, this was in over 198,000 women and 293,000 men. So it was over 500,000 people. And they found that your total intake of calcium, if it was high from food and from supplements, a 20% lower risk of colorectal cancer among men, and a 30% lower risk of colorectal cancer among women. What they're finding in some of these studies is when you get enough calcium, you don't develop polyps, and polyps are generally the source of most colorectal cancers. Now, what about other cancers? I don't know. There's not enough research. There's some evidence from the Nurses' Health Study that calcium supplements reduce the risk of breast cancer in premenopausal women. And in a women's health study of more than 30,000 women, there's evidence that high intake of calcium reduces the risk of breast cancer a little bit. But once again, in premenopausal women. But when they looked at the Women's Health Initiative, which was a big study out in Washington on more than 36,000 women, they found that in older women, calcium reduced the risk of breast cancer and invasive breast cancer. The risk reduction was 14%, and reduced the risk of colorectal cancer by 17%. So there is something about calcium and cancer. I used to have a pharmacy in Manhattan called Hickey Chemists. I had a couple of pharmacies in Manhattan for many years. It was so much fun to be in Manhattan and have a pharmacy. But I used to have medical doctors from Sloan Kettering, which is one of the leading cancer treatment and cancer research centers in the world, sending me their clients to get calcium supplements. And when I called one of them up, I said, I've been reading studies on calcium and cancer. This is going back to the 1990s. And I told them I've been reading studies on calcium and cancer. And they said, yeah, we recommend cancer. We recommend to our cancer patients that they take calcium supplements. It really seems to have an impact on helping them treat and also helping prevent cancer. That's what they told me back in the 1990s, directly from the doctors at Sloan Kettering. So how much calcium a day? I mean, listen, it's easy to find out what foods have calcium. Green leafy vegetables, including lettuce, of course, dairy products. But when you get older, I think you need a little bit more. I think in general for people, 1,000 milligrams a day is sufficient total calcium intake from food and supplements. But when you hit 50 or older, you need more like 1,200 milligrams a day. And that's also, of course, the time when the risk of cancer becomes more common. So, but, calcium affects you from head to toe. It's an undervalued nutritional supplement. So thank you for listening to the Invite Health podcast. You could find all of our episodes for free wherever you listen to podcasts, or just visit invitehealth.com/podcast. Please subscribe and please leave us a review. You can also follow us on Facebook, Twitter, and Instagram at Invite Health. And I hope to see you next time on another episode of the Invite Health podcast. And thank you so much for listening. Jerry Hickey signing off.